So someone wanted to ask about what's the difference between AION, PION, NAAION, AAION, and APION, and NAPION. That's a mouthful. So AION is anterior ischemic optic neuropathy. It is a neuropathy of the optic nerve due to ischemia, and the A is the most important part of that acronym because it means anterior. And what that means is anterior to the lamina cribosa, and that means we have to have disc edema. And AION has two flavors, NAAION, which is the non-arteritic form, and that means it's not giant cell, and the AION form, which means the arteritic form. And so it's really important anytime we see a patient with AION to make sure we rule out giant cell. And that means talking to the patient, asking about the symptoms, doing a sed rate and CRP, treating with steroids empirically, and doing a temporal artery biopsy if we have suspicion for AION, the arteritic form. There is no test for the non-arteritic form, and so this really is a diagnosis of exclusion. You have to exclude AION before you call it NAION. PION is posterior ischemic optic neuropathy. Posterior means there is no disc edema. That one can be arteritic or non-arteritic, but in an elderly patient, it's almost always arteritic. The non-arteritic form of PION, posterior ischemic optic neuropathy, where there's no disc edema, is almost always after surgery, usual general surgery procedures like cardiac surgery or lumbar spine surgery, or from hemodialysis or from a big blood loss. You should not make the diagnosis of NAPION without working it up. And all retrobulbar optic neuropathies, whether it's arteritic or non-arteritic, are going to have an MRI. And what we're looking for is to make sure it's not a compressive lesion and also look for enhancement. And so even though these acronyms sound similar, it's really super important that we not just say something's ION, ischemic optic neuropathy, or AION, anterior ischemic optic neuropathy, because that does not provide the etiologic diagnosis. NA versus A, that's really what you should be doing, regardless of whether you're dealing with AION or PION. Your first job, make sure it's not AION or PION, and that's giant cell.